Good afternoon, everybody. My name is Erica Crespo with the Anticancer Lifestyle Program, and today I am so pleased to be talking with Nancy Kane, who is our co-founder and executive director. How are you today, Nancy?
I'm fine. Thank you for doing this, Erica.
Thanks for being on here. It is your first Facebook Live. I was just telling you, I'm so excited to be doing this with you.
It's great. I'm looking forward to it.
Good, because being that it's Oncology Nursing Month, there really is no one better to give us some firsthand advice accumulated over your years of experience as what we can do to lead an anti-cancer lifestyle. And that's really a lifestyle that works towards the prevention of cancer and chronic illnesses and prevention of recurrence if you've already had cancer. Nancy, before we get started, I think it's important for our viewers to know that along with being our co-founder, you are also the founding director of the Payson Center for Cancer Care at Concord Hospital in New Hampshire, and you served as their director for 12 years. You've been a registered nurse for over 40, holding clinical education and administrative positions in hospitals and cancer centers throughout Virginia, New York, and New Hampshire. So if you're watching, get your pen and paper ready because you are literally about to learn from the best. And as we go along today, if our viewers have any questions, please feel free to put them in the Facebook comments and we will do our best to get to them. All right, Nancy. Cancer and Nancy together. Oh my goodness. So my first question for you, I want to start at the beginning. As an oncology nurse, when and why did you become interested in the area of cancer prevention?
Well, before I answer that, I just want to give a shout out to all the oncology nurses who we're celebrating this month. I mean, those of you who have interacted with cancer nurses know they're a very special group, and we owe them all a debt of gratitude for the kind of work that they do. So, that
Great.
said, as you mentioned, I did spend really my entire career on the treatment end of cancer and the support end of people, already diagnosed with cancer. But, it became quite clear to me and I would just say that there is no more exciting time to have been, from a professional point of view and a personal point of view, given that I have people with cancer in my family, that this has been a very exciting time for all of the wonderful breakthroughs we've had in diagnosis and treatment. The area, though, that became more and more compelling to me in the last probably decade or so is the realization that the kind of most important thing, the legacy that we can leave of this very exciting time is figuring out how to help people not get cancer at all. I mean, if we can figure out a way, and there are ways, to help people reduce their risk for developing cancer, or if they have cancer, as you said, to reduce their risk for recurrence, we have that knowledge now. We just need to put it into action. And so that was the birth of the Anticancer Lifestyle Program, the idea that we can do this. There's evidence out there. We just need to find ways to get that information to people and to help support them to make the kind of changes that we know are beneficial for them in the long run.
You mentioned the knowledge that we have now. So I know a lot of us were raised or grew up thinking, especially if there's a lineage in our family of family members with cancer or specific type of cancer, that it's bound to happen to us. It's hereditary, and that might give us a bit of a fatalistic outlook on our lives and our approach to our own healthcare. So I'm wondering, in your opinion, how important is heredity in one's personal cancer risk with the information that we know now?
It's a great question, because I think you're right. With the explosion of knowledge that has happened in the recent past, we have a tendency to think that we know everything there is to know, and that there are so many cancers that are hereditary in nature, when in fact, only about 2 to 5% of cancers are truly hereditary. So that's the both the good and the bad news. The good news in that is that means the majority of cancers exist because of other risk factors, many of which, probably with the exception of aging, that we can affect by the behavioral choices that we make. And I think it's, it is not to underestimate that there are known hereditary factors. Breast cancer is probably the best known one for the BRCA1 and 2. But even in that situation, we know that for people with those genetic mutations, even still, making behavior change, evidence-based behavior change, as we outline in the course, can make a difference in the development of their cancer. So you used a great word, that fatalistic view, and I would really encourage people to try and let that go, even if those genetic mutations exist in their family, and to focus on the positive, which is there's a lot that you can do that's within your power to affect your own personal risk and that of your family and people.
Right. So there's a lot we can do. So that leads me in perfectly to my next question about what modifiable risk factors are best for us to focus on. And are there some that'll give us a bigger bang for our buck than others?
Well, I would be remiss if I didn't mention the biggest bang for the buck, which is tobacco use. I mean, it's clear, and we've known for a long time, that the most powerful modifiable risk factor is the use of tobacco. And I specifically say tobacco and not smoking, because smoking, of course, we know is a strong risk factor for the development of cancer and other chronic illnesses. But it's also important to know that smokeless tobacco, chew and snuff, that are used especially by young athletes sometimes, also increase risk. So if one were to say what is the biggest bang for the buck, that would be the one. However, I think it's important to look at this just a little differently. So we know that there's a great deal of data in the areas of diet, achieving healthy and maintaining a healthy weight, physical activity, limiting alcohol. There are many different factors, moving more. And so I guess the advice or the thought that I would share is that choose something. While the biggest bang for your buck, and we know that the synergy of making all those changes all together would be terrific and give you the greatest boost that you could possibly have to your health. Realistically, let's be realistic here, choose something. If diet is the issue that you are the most motivated to try and address, if you're interested in learning more about a more plant-based diet, if you're interested in learning more about how to decrease inflammation in your body through diet, if you're interested in those things, then choose diet. Start there. Work through our anti-cancer diet module, for example, and get to the point where you feel like you've accomplished this. I've learned a lot, I've made some changes, and I think I can sustain them. And then think about moving on to another one. So again, I would say the synergy of making all those changes is the biggest bang for your buck, but realistically, just start somewhere. Make some changes, sustain those changes, and then if you're willing and able, move on to another area that motivates you to want to make change in that area.
Yep. And like you said, you can start on our online program at anticancerlifestyle.org. And we recommend you go in order, but we specifically split it up into individual modules. So mindset, fitness, diet, environment, just as Nancy was saying, you can pick the one that might be most painful to you at a specific time in your life and go through that at your own pace. You mentioned tobacco as a modifiable risk factor. And we know tobacco is linked to lung cancer risk, but is that all that it's linked to?
And that's another great question, because that is, I think, while maybe not quite a myth, I think the best known link is smoking and lung cancer. And we've done a good job in this country, both through policy and through education, to reduce smoking.
Mm-hmm.
Smokeless tobacco, as I mentioned, is another issue for oral cancer in particular. But tobacco use, believe it or not, is linked to an enormous number of cancers, not just lung, but esophagus and the oral pharynx, as I said, breast cancer, kidney cancer, bladder cancer, and I could go on, endometrial cancer. So I guess the take-home message there is, if you are in a position to influence a young person in your life to never start, that would be the most important thing. But if you're in the situation where you do use tobacco, know that at any age that one stops cigarette smoking, your life will be extended. If someone stops smoking by the age of 30, data shows that they will most definitely extend their life by at least 10 years. So I guess the message is stop at any time. But the most important message, since our topic today really is prevention, is finding ways to never start. And that really is a youth focus, obviously a youth focus, something to focus on in that population.
Right. So my next question for you is maybe a little heavy, but I'm interested in your opinion on how many cancer cases and cancer deaths do you think, Nancy, could be prevented if modifiable risk factors were effectively addressed?
Well, without giving an absolute number, what I would say is that the American Cancer Society says that nearly half of cancer cases could be prevented if modifiable risk factors were addressed effectively. So, the take-home message there, it's a lot. It's a lot.
Mm-hmm.
Many, many, many cases.
Yeah.
I think the most important message in that question, and really in this whole discussion, is there are things that you are empowered to do by accessing evidence-based, accurate information. You can reduce your risk for ever developing cancer. I mean, cancer, as we know, is develops over many years, and so much of, even though the Anticancer Lifestyle course may be focused on adult learners, the content in there is relevant for young families and young people to start those habits early, whether that be diet, whether that exposure to environmental toxins, whatever it may be. That the earlier you're able to start modifying those risk factors, addressing those risk factors that we've talked about, the greater the chance that you'll either prevent cancer from developing, but most certainly you will reduce your or your loved one's risk for development over their lifetime.
Wow. Well,
Powerful.
very powerful. Take a minute to sit with that information. It's really a family affair too, the way you put it, of how we can help and support each other. So we are on the cusp of a long weekend, Memorial Day, the start of summer traditionally. And this one in particular, we have this sense of freedom. Many of us are vaccinated. It's maybe our first long weekend in over a year that we're going to be with family or friends or maybe traveling somewhere. My family and I are going to a place with a lot of sun and a big pool. I'm very excited about that. But thinking of sun and sun exposure and tanning in summer, outdoor sun exposure and indoor tanning beds, is the risk the same? Is one better than the other?
That's a timely and great question. And those of us here in the Northeast, we are eager for sun since we have such a short period of that. So I understand the draw, and certainly societally having tanned skin, if you're Caucasian, is considered something that's attractive. Being pale is not. But in fact, indoor tanning and outdoor sun exposure, it's the same thing. It's ultraviolet lights. I would say that the difference and the really important thing to recognize is indoor tanning is something you can't do anything about. If you're lying in that tanning bed, those lights are coming at you and there you are. But in outdoor sun exposure, there are many steps that one can take to modify your risk. Obviously, a sunscreen that has been deemed safe by, you can look on our website and link on to the EWG website to find a good choice. Staying out of the sun at the peak time of day, between 10 and 2. And if you're going to be out there, cover up some. Wear a hat, wear sunscreen, and wear, sun blocking clothing. And again, I just want to reiterate the idea of long time and cumulative exposure. This is an incredibly important issue for young families to think about, because skin cancer, we know, is an accumulated exposure cancer, right? Over one's lifetime, the exposure to sun and ultraviolet light is what is going to cause that cancer. So unfortunately, tanning beds are no better than outdoor, except outdoor, there are many steps you can take to mitigate your risk somewhat.
Yes, and they're getting even more like fashionable hats and protective clothing. I mean, there are, especially as women, there are a lot of steps we can take that we didn't have years ago to protect us and still look good and feel good and enjoy the sun. So
that's a very good point. That's true. That's true.
Well, thank you so much for your time today, Nancy. I really appreciate it. And I'm sure our viewers learned as much as I did. And if you're inspired to learn more and really start taking control of your health, as we always say at the program, please visit our website at anticancerlifestyle.org. All this advice you heard today, we have all that and more in our course that you can take at your own pace, and it's free and it's expert led. So Nancy, thank you for joining me today. I hope you have a wonderful holiday weekend, and
you too, Erica. Thank you so much.
Bye.